The special thing about Mayo is the multidisciplinary care, which is part of our culture, is what enables us to do things that outside of our walls are considered impossible.
I started to notice a growth on my neck. So I went to my local primary care. Within a couple of months, they had diagnosed me with an arteriovenous malformation.
That specific malformation creates what is called shunting, where the blood flow goes from a wide caliber vessel to a vein directly without going through a capillary network.
Fast forward to the end of my Ph.D, and after I had accepted the position to come to Mayo, then I thought, well, let's get a second opinion.
When I first met Jamie, we had an open and candid discussion, and Jamie was understanding. He knew that without treating his problem, he's going to die.
My number one concern was the fact that there was clear evidence that the AVM, even though it's in the neck, it was so high flow that it was causing a significant impact on his heart.
He was having a dilated cardiomyopathy, which means that his heart was abnormally large.
In my estimate, if we could reduce the flow by about 80%, then we can have a better understanding of what's going on, and surgery would be a possibility.
When I was sat down and told, we think we're able to surgically treat this AVM, it took a while for me to believe it, because I'd been told no, sorry, so often. To then be told yes was quite special.
Without a multidisciplinary team, it's easy for someone to look at this and say, this is inoperable, or there's nothing that can be done.
What Dr. Jibril had done is he took on the case and wanted surgeons that he knew could coordinate well enough together to be able to get through this operation with a successful outcome.
When Dr. Jibril first called me, he was like, this kid is, going into heart failure. Well, if we can't do it, then who can? This kid doesn't have other options.
Having a culture in which it's very easy and collegial to reach out and talk to people across different specialties is why Mayo is really well suited to some of these cases that require such multidisciplinary collaboration.
Going into this case, you're obviously worried about bleeding. Very, very high risk to have potentially catastrophic bleeding for something like this, and I think the embolization allows us to try to tamp that risk down a little bit.
My role was really going to be in making sure that as they get closer and closer to that vascular malformation, that if sudden blood loss were to occur, that I'd be prepared to keep up with that.
The dangerous moment was the time of removing the vascular malformation. We had a plan, we had communication and discussion about which teams would be doing what at what time period. And what we found is we were all working together. Everything was seamless.
After the surgery, coming through the other side, that was representative of Mayo's attention to the needs of the patient. I know from my parents' experience that what was really special to them, they were part of the team and part of the care experience as much as I was.
He's definitely better, and all the imaging looks like there's nice reverse remodeling, meaning that the heart is going back to its normal state in terms of size and function.
The AVM was 100% gone, and I was shocked. What I saw was the impossible becoming possible. I saw a year of hard work and planning from several physicians. I saw the work of the people that were involved in his care. And we did something that no other place in the world would that be done.
When you add the collaboration and the ability of the different teams to work together and support each other through this journey, that's when great outcomes happen. And this is what makes working in a place like Mayo Clinic so special.